Welcome back, friends. Carry on, Fire Family. You know what's up. Today we're tackling a topic that comes up all the time: therapy versus coaching. What's the difference? When do you need one over the other? And how do you know who's the right fit? So to help us unpack this, I asked Destiny Morris to come and join us today. If you know her on Instagram as On Being Resilient, her content is amazing, but she is a culturally competent therapist, which is very huge for fire families and first responder families in general. She works with first responders and beyond. She works with first responder spouses a whole lot, which is awesome. We need more of her. And if you haven't noticed, I still have a cold, so sorry in advance. Her approach is warm, collaborative, and honestly, it's so refreshing in a field that can sometimes feel intimidating. Let's bring Destiny in and chat it up. Destiny! Welcome.
It's good to see you.
Okay, if you see me wiping my nose, no, you didn't. Okay. Okay, tell me a bit about your story, why you became a therapist, all this fun stuff.
Absolutely. So I am a licensed first responder therapist in the state of California. And I started by just going to normal schooling, wasn't really sure what I wanted to do. I grew up in a first responder family. My dad is a first responder. And then I was in a first responder relationship through grad school when I had kind of narrowed down what I wanted to do. So I knew that I wanted to listen and work with people. I just wasn't sure what my specialization was. So because I come from a first responder background, that definitely intrigued me wanting to work with this population because I knew it and it was a part of my upbringing. And then because I was in a relationship with a first responder in grad school, that like tenfold made me want to provide more resources for first responders. And then I would say the icing on the cake for me was I worked in a psychiatric hospital and I saw way too many first responders who were getting sent in there for just general population care. And I realized that there was definitely a need for more people specializing in this. So I got my certifications, did EMDR training, got first responder therapist certified, and I'm here now with the private practice.
And look at you. I think when I met you, what was it, like 4 years ago now?
More than that, like
Oh
7.
my gosh. You were in the thick of it.
Yes.
It's so cool to see where you are at now because you are a rock star for sure.
Thank you. Yeah, that was a long time ago.
It was a long time ago. Oh my gosh. Okay, let's start simple. How do you define therapy?
Just therapy?
Yes,
Okay.
just therapy.
We'll start there. Okay. So, therapy, or what a therapist is someone that has done the credentialing. So, the hours, the grad school, someone with a master's degree. In California, every state is different, but in California, we need 3,000 hours. And you have to have all of those done plus your master's degree in order to be a licensed therapist. And at that point, you have to take a licensing exam and a law and ethics exam. So, that's the schooling side of it. The non-schooling side of it is therapy is the ability to sit with a person, seeing all angles, but also being trained to go to places like trauma and childhood, and kind of interweave all of those together to make sense of what the presenting problem may be or where it comes from. And another part of, I guess, trauma therapy that's important to look at too is someone who's been trained in specific modalities like EMDR therapy to be able to assist someone who's seen trauma or experienced trauma. So that's a whole nother like sector of therapy is trauma therapy.
Okay, and how is it different from coaching?
Okay, I was waiting for that. I'm like, which one do you want first? Um, So I want to preface by saying that I'm not here to talk bad about coaching. I think that coaching is a beautiful and a wonderful resource. But there is a huge difference, and there is a very, very blurred line on social media nowadays with coaching and therapy and those words being interchangeable, which they should not be. So, coaching is someone who has experience and preferably has some training as a coach. There are certifications to be able to work in one specific modality, such as finances, physical fitness, motivation, um,
Like health and
uh,
wellness.
health and wellness. Yes, yes.
Okay.
Any of those. So you're kind of in a specific category and you work in that category, not going back and understanding where it comes from or why, but just moving forward with goals to help assist someone to get to their destination.
Yes. So, what are some signs that someone needs therapy and not coaching? What are you
Okay.
looking for?
Yeah. So someone that is looking for therapy is typically someone who is struggling with anxiety or depression or PTSD or has seen a traumatic event. All of those things should not be going to a coach. A coach is not trained in those areas. There are a lot of like anxiety coaches or depression coaches online. I do not agree with those. I do not believe that coaches have enough training to be able to sit and explore and treat these really serious conditions. And it's honestly, it does harm to people when they go and see a coach for these things instead of a therapist. So, someone that's having those kinds of symptoms, absolutely see a therapist, and you'll be able to track back where they come from. And then also with a therapist, you'll be able to have goals and move forward. So, what's interesting about therapy is that some of the stuff that coaches do, therapists also incorporate. It's not just coaches that do that. So if you're like, oh, I want to do therapy, but I also want the coaching experience, you're going to get that in therapy if you're working with someone who's goal oriented, anyways.
So, coaching really is like future focused. It's like
Yes.
growth, strategy, clarity, not treating trauma, not diving into your brain, not teaching you, maybe not teaching is the wrong word, like not analyzing, maybe?
No, no analyzing.
Yeah, not analyzing at all, right? It's not a replacement for therapy in any way. It can be
Exactly.
powerful, but it's not a
Mhm.
replacement for therapy. So, it would you say that it would be like if you are thinking about a coach and you haven't been to therapy, maybe you want to explore therapy first before you go into coaching? What do you
I
think?
mean, I may
Maybe.
have a biased opinion there, being a therapist.
Okay, valid.
Um, I truly believe that therapy again incorporates all of that. So if you are looking to explore where things come from or change, the motivation that you are experiencing or lack of motivation, you can see a therapist and they will help you with that. Absolutely, we are trained to do that. The big thing here too is in the beginning I kind of explained the hours and the different degrees that a therapist would need. Um, the thing that can be really scary about coaches is they don't have any ethical guidelines. There are no ethical guidelines that keep them or um, even like, if they were to do something wrong, there would be no consequence. Whereas,
Yeah.
as a licensed therapist, I have a code of ethics that I have to stick to. And if I do not stick to those, I will lose my license. I will go to jail. There are consequences for my actions. And that makes my job and what I do even more serious. Whereas a coach doesn't have any ethical guidelines outside of their own personal boundaries.
Yep. And there's not a requirement for confidentiality or anything like that.
No, there's no confidentiality. That's part of the ethical guideline. We have a licensed therapist. There is no rule about scope of practice. I see this a lot on Instagram where I actually see it a lot with first responders, and I love their heart to serve. But I see a lot of first responders who have had PTSD. So now they are coaches for PTSD. And because they have gone through it themselves, they believe that they can coach someone through PTSD as well.
Oh boy.
I know I'm gonna make some people angry with this one,
No,
but
that's
that's
okay
fine.
because it needs to be said. So,
It it does because I do believe that it can be dangerous.
yeah,
Um, and it doesn't discredit the individual's journey.
absolutely. Hmm.
I use books as resources all the time for my clients, first responders who have written memoirs. And I find that to be really encouraging for my clients. I always use that as a resource. But for a coach that's saying, oh, I went through PTSD, therefore I'm going to be able to help you get through PTSD, but they have no clinical training or ethical guidelines or boundaries with what that looks like, that can be extremely dangerous because you're not actually treating PTSD at that point.
Yeah, it's almost like, and again, like no one is bashing coaches in any
Yeah.
way, but it's almost like you're kind of making, I don't want to say, well, I'm going to say it. It's like you're compartmentalizing it instead of treating it or understanding it, right? I think, and coaches, I'm sure they come from a good place, right? They want to
Yes.
say, and same thing with me, like I, put a lot of what I did to overcome my stress and trauma, but I also always say I also went to therapy. So,
Right.
because it's a
Yes.
critical component that, like, I don't think can be done any other way. Like, you have to go to therapy to understand yourself. And then once you understand yourself, then the coaching makes sense, right? Because then it's about growth and it's about your
Right.
journey forward.
Right.
And I mean, to be completely honest with you, my therapist was amazing and taught me how to also go forward. So, but
Good.
it depends on the kind of get the season in your life too, right? Um,
Right. Yeah. And again, there's nothing wrong with coaching.
mhm.
I think that some people are looking for more just quick, short term.
Yep.
I want to move forward. I'm having a hard time with this topic or this topic. What can I do? And there are great, I see like fire wife coaches out there too,
Hmm. Yep.
who specifically coach on the topic of how to move forward as a fire wife.
Yep.
I love that. I think that's an
Totally.
amazing resource. There's nothing wrong with that. The line blurs for me when someone is saying that they're treating trauma because they've experienced trauma, or they're treating trauma just because they think that they can sit
Hmm.
with people and they have the gift of listening, which is a great quality, but it does not make you a clinician.
Totally. Yes. You did not have to sit through 3,000 hours of.
Yeah.
Okay, give me some red flags for coaches.
Yeah. I'd like to give you red flags for therapists too, so that
Yes.
it's not one sided.
Oh, yeah, yeah.
Um,
That was going to be
okay.
my next one. Okay,
Okay,
but we
good,
can go
good.
back and forth. Again,
Perfect. I was
this is
like,
not a
I don't want
coach
to just
bashing session.
no, 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 no. I'm like, there's red flags in therapists too. Okay, we'll start with
Hmm.
coaches. So, some red flags with coaches, which I mentioned a little bit already, was someone that says they're trauma informed, someone that's saying that they can treat, someone that's saying they can diagnose you, someone that is saying, I've seen some before that will say, I don't believe in diagnoses, which feels really good for the client who's looking, right? Like, wow, they're not going to diagnose me. There's no stigma. They're just going to sit with me and my stuff. That's a red flag. Not that we need to diagnose everything, but that's their way of saying, like, I can't diagnose if I wanted to. So I don't believe in it. Um, let's see, what are some other, those are like the biggest. I also see a lot of like coaches call themselves practitioners. So I see a lot of this on Instagram as well, breath work practitioners or yoga therapists or what else do I see? Like there's a lot of different things. Reiki, practitioner. A practitioner is an interchangeable word with clinician, which means that you have the degree, you have the training to back up what the letters behind your name say. Um, now, the thing that frustrates me and I know my fellow therapists is that we do a lot of schooling. We spent a lot of time learning different modalities, learning how to work with specific populations, first responder community. I've done a lot of schooling and a lot of training in order to work with this specific population and be culturally competent with it. I will see people who just don't want to go to school or they don't want to do all of that training or that time or they don't want to pay for it. So they go the coach route because they find it to be easier. So
That
I see
makes
that as a
sense.
red flag. One thing I want to throw in here too is that there are a lot of therapists who are also coaches, and I'll tell you why. This is maybe a secret. Hopefully, I'm not ruining any other therapist stuff, but the reason why therapists will also be a coach is because underneath the therapist name, we are legally bound only to the states that we work in. So I am only licensed in California. I cannot see someone in Washington. But if I'm a coach and I do coaching,
Oh.
I can see anybody anywhere. So
Oh.
that is a way that therapists will often kind of extend their practice to people outside of their state or their area. And I can see the business side of it. I personally don't do it because I don't know how I would turn therapy part of me off and just become a coach.
Hmm.
It would be very challenging. I would have to like stick with a very like defined population and only do that work and try really hard not to go back to their past history or trauma. I would not be able to do it, but I know a lot of therapists who do just because it helps their reach a little bit more as well.
That makes sense. I didn't think
Yeah.
about that. Yeah, that does make sense. That would be hard to turn off, I think, too. You would do that.
I couldn't do it.
Okay. So coaches, again, great
Mhm.
for future therapists, great for past.
Yes. Yes.
um, all the, okay, therapists, for, red flags for therapists.
So red flags for therapists would be a therapist who is only listening and never giving feedback. A therapist who is always validating and never giving like any kind of constructive
Oh,
criticism. A therapist who is not listening, is distracted, is on their phone, is texting during session, is all these different. I've heard horror stories. I know.
oh, jeez.
Anything like that is a very obvious red flag. But the not so obvious red flag is when you're just talking, and your therapist never stops you and says, wait a second, can we go a little bit deeper? Can we work on this? Or asking constructive questions that make you think. Because at that point, you could call a friend up and just talk to them for free, right?
Totally.
That's not therapy. And then constant validating and saying, oh, no, but you're good. You're right. You're great. Obviously, validation has its point and it needs to be a part of therapy. There are people that need that validation. But if that is all you're ever receiving and you're not getting any constructive criticism in therapy or goal oriented work, that to me is a red flag.
Yep. Makes total sense.
Yes.
Total
And
sense.
I think it can get kind of confusing for somebody looking for a therapist to see all the different letters behind someone's name. So for mine, LMFT is Licensed Marriage and Family Therapist. That is usually what most clinicians in California have. There is something that's LPCC, Licensed Professional Clinical Counselor. That's
Oh,
also a licensed person. You want to look for the L. There are social workers, but they also have a L licensed master's social work. If someone just has a master's degree and they are not licensed and they are not underneath a supervisor as an associate, then they should not be practicing as a clinician. I have seen this in the past where someone would go get their master's degree but not do any of their hours and not sit for any of their exams in order to be an associate or register as an associate. And then they'll try to say they're a therapist, but they'll market it as like, they'll call it therapist, but they'll market it as coaching. That is a red flag. You want to find
mm.
someone that is either licensed or an associate underneath someone that is licensed. That is, and then obviously you could find someone with a PhD. That's a little bit easier, a doctor, so and so.
And when you get to the doctor level is when the prescriptions come in, right?
Exactly. Yeah. Yeah.
Yeah.
Psychiatry has and psychologists as well. They can do more therapeutic intervention with medication management.
Yeah. Yeah. Okay. Good to know. I didn't know about the L. I knew what it stood for, but I didn't realize everybody had that L in there. So that's actually very helpful. Thank you. Useful tools. Hey. Okay. Let's get off the coach topic for a second. You said in your bio and your on your website, which is so good, you mentioned dark humor with first responders. What's a way that dark humor really helps in your sessions with first responder families? I mean,
Uh,
I know why, but I want to hear it from you.
okay. I naturally have dark humor. I
Yes.
think that because I grew up in a first responder family, it is what my whole family uses. I've used it in my personal life, so it came very natural with working with first responders. It is a coping skill. We call it what it is. It's a coping skill when there's discomfort, when we need our brains to move forward and not get stuck on something. Dark humor is a go to, especially for first responders. It's their
Mm,
way of compartmentalizing and moving forward. There's nothing wrong with it. The only time I see something wrong with dark humor is if we're constantly using dark humor so much that we're not able to actually sit with the real feelings that are coming up around the call or even in my own life, right? If I'm using too much sarcasm and dark humor, I have to kind of reel it back and see what I'm avoiding.
yes. Did everybody hear that? Do we need to say it again?
I'm curious, what were your thoughts on dark humor? Where did your mind go?
Pretty much exactly what you said. Like
Okay.
I know how my husband uses it, and I know how they use it around the table at the fire
Yes.
station,
Yes.
and I know how we use it in our house. And sometimes I'm like, oh, okay, we're going too dark there. We gotta pull
Yes.
it back. And
Yes.
it's often usually because it's something uncomfortable that we don't really want to talk about, so we make very inappropriate comments about it, and then when you dig a little deeper, it usually comes out why we're
Yeah.
feeling that way. So, yes,
Yes.
we
Yes.
often have to rein it in at our house too. Okay.
So, and that's at home and at therapy. I find it to be very important that someone who is quote unquote culturally competent to work with first responders understands and might even use dark humor in sessions or welcomes it. Because most first responders use that, like you said, around the
Hmm.
table or at the firehouse or whatever, right? They should not have to conform to an uncomfortable standard of speaking or how they present themselves in therapy. They should be able to show up as they are. So, a red flag would be if a first responder came in and made some joke about a call they went on and called it something funny when it was something like very gruesome, and then the therapist who's a first responder therapist respond with like, "Oh my gosh, that's I'm horrified. Why would you make that joke?" That right there is why first responders don't go back to therapy. So it's important for me as a culturally competent therapist, not I don't have to partake in it if I don't want to or I don't feel comfortable. But if a first responder makes a joke like that, I can go, I can see why you would joke about that. I can even point it out. Like, you're using dark humor. I appreciate it. It is funny. I'll laugh with you if it's funny. But I'm also going to circle back around and be like, okay, dark humor aside for a second, what was that like seeing that gruesome scene? Like, did that bring up any feelings for you? Like, what's going on there? So I think a good mix of both is important.
Yeah, I love that too. And then, like, so going to the culturally competent again, like what you just said, very important for fire families because
Mhm.
there are a lot of people, therapists out there who claim to be culturally competent,
Yeah.
but they might not be, right? So tell me what culturally competent really means
Yeah.
to like first responders, especially because it's
Right.
something we talk about it all the time. So,
Yes. Yes. So this wraps back in that term trauma informed. And trauma informed means that you have the training and the specialization to work within this population. So I have EMDR training, and that is a trauma modality that we use to treat PTSD and trauma in general, which is what first responders typically come to therapy for. And then on top of that, I have a certification to be a first responder therapist, which helps me. I mean, I grew up in it, but it helps me even more understand the culture, all the different elements, the terminology. Um, that is the most important thing. So if you're calling a therapist and you're vetting them and they are advertising themselves as a first responder therapist, one of the first questions you want to ask them is, what training do you have to work with first responders? Now, if they just say, well, I don't have any training, but I am a fire wife. That's great. They might have some understanding, but they're not going to be able to treat trauma without any modalities to treat trauma. CBT therapy is very common. I think every therapist across the board is taught that. It's cognitive behavioral therapy is what it stands for. That is going into your thoughts, deconstructing them, kind of changing the way you think. Cognitive distortions is a term that we bring up a lot. That is like baseline therapy. If a therapist is only trained in CBT and is not trained in any like EMDR or IFS is another one in internal family systems, any kind of trauma modality, ART is another one. If they don't have that, then they should not be working within a trauma population.
okay. I love that. Thank you. That is extremely helpful because we
Mhm.
often have people looking for culturally competent therapists. I was just talking to someone yesterday, asking him how he vetted his therapist, and he said, "Oh, well, they have to go through a master's program." And I was like, "No, no, no, that's not what I asked. Like, how are they culturally competent?" He's like, "Well." I'm like, "No, no, no. Like, I need
Yes.
specifics because
Yeah,
it's
there should
very
be a
important."
checklist.
Mm-hmm.
Yeah.
Yeah, yeah.
Yeah.
Okay. I'm gonna talk to you about breaking the stigma, especially when it comes to first responder families. How do we, and I think we've been doing a good job of it, right? And there's a lot more first responders and their families that are open to therapy, but I think that that stigma still remains, right? So what do you think? How's the progress going? Like, what's your kind of intel on the stigma around therapy and first responders?
Yeah. Okay. So I think that we are moving in the upward direction, but I also have to say that it varies from department to department. So some departments are with it and they're providing a lot of resources and talking about it. And they have more of a culture of being able to share personal experiences. And I think that's very important for someone to be able to speak out and go, hey, I've struggled with this in the past and this is what it looks like, and normalizing it. That does not happen at every department, unfortunately. And most departments don't. So as far as like an overall, yes, we have more like mandated um like things that hoops that you have to jump through, but that doesn't mean that it's actually mental health care. I see this a lot too, where some departments they'll kind of like check the boxes for their mental health care, but no one will use it properly or they won't actually give them good or solid resources. So no one wants to use it. Or there's still that stigma because of the way that management treats their crew or however, right? Everybody up above. If there is someone up there that's saying, like, oh, just, go to work and this is what you signed up for. And if you're struggling with this, then you should quit your job. Then no one else on the crew is going to feel comfortable. So unfortunately, it's a trickle down effect. It has less to do with what I can do as a clinician, and has more to do with what each specific culture and department looks like. And that's out of our control sometimes.
How do we bang it into these people's heads that everyone should see a therapist if they need one, and that there's no shame in it? I don't know how many, like, we could shout it from the rooftops and
Right.
it's still only going to stick with, I don't know, a handful of people, right? I think it's getting better, like you said. It's just, yeah, it's one of those things where it all depends on, I think, yeah, trickle down, right?
Sure.
Chief, who's embracing it on that particular crew, if your
Yeah.
leadership is good, all those things. I think now, especially like with more agencies have that peer support to start the
Mhm.
conversation, and then obviously look for the signs to kind of push them to continue on their journey if they need to reach out to a therapist,
Yeah.
is getting better. But
Yes.
I wish it was like mandated, like you said.
Yeah.
It would be
Yeah.
so
Yeah.
nice.
Yes, I do see the pros and cons of that too. Like mandated would be nice because they would have to, but then we all know that therapy doesn't work unless somebody actually wants to do the work.
Very
So
good
that
point.
like forced therapy might not be well received. I'm also very curious to see what happens in the next decade when this older generation starts to retire out, and then we have this younger generation who's taking these like chief positions. I think there's going to be a lot of change there because this younger generation of first responders is growing up with more normalization culturally. And as a man, specifically, if we're talking about men, like that um, idea of men having emotions and going to therapy and talking about it, that is more generalized versus these like elder millennials and boomers and right, these older folks who did not grow up with that. They grew up with men don't cry, they don't show emotions. My dad didn't, so I don't. I'm curious to see the change that's going to happen over the years.
Yes, I completely agree with you, because I definitely see a shift in the newer crew where they are more in touch with their feelings. They understand themselves a lot better just as a whole.
Yeah.
But I think this is going to sound crappy, but it's true. I think there's a little bit of con to that, because
Yes.
they, I don't want this to come off.
I know what you're going to say. You can say it and I'll smooth it over.
It's a little selfish sometimes, maybe, right? Like, and not like, not selfish in a bad way, but selfish where, like, no, I'm going to take this day off. I don't care who this affects. Like,
Right.
I'm going to take the time for me because I need it. Or also, in terms of like being on a crew, being like, actually, no, I don't want you to talk to me like that. Like, no, I'm not going to do, which actually I like, but in the culture in the fire service, it's very frowned upon, right? To speak up.
Yes.
And so there's that fine line between like the respect and the being able to say what you feel and what you
Mhm.
need.
Mhm.
So it's interesting. The dynamic of it is very interesting.
Yeah, I want to label that. So what you're talking about is this new generation that has a air of entitlement, where they are
Yes.
entitled. Yes, they're entitled to their time off or their self care days. And I I probably see more of the crusty, crunchy first responders than I do with these newer generation guys. And I would say that majority of our sessions is talking about how frustrating it is because these newer guys are having like, I had anxiety, so I can't come to work today. They call them softer, right? And
Yes.
again, there's both sides of it where yes, you should still have responsibility, you should still care for your crew, you need to show up, but also knowing that fine line of like, what is a crisis versus what is I didn't get enough sleep last night, so I'm feeling a little anxious. Like, and also what are your coping skills? Because this generation that is rising up too is unfortunately diagnosing themselves with social media and TikTok, which is very dangerous. Um, Constantly labeling, these things as mental health when it's just like, no, you didn't eat lunch. That's why you're crabby. Like, you don't have whatever diagnosis you think you have. Like, it's being a human. And so there is this sometimes a crutch that people use with mental health, unfortunately. There needs to be a balance. I think that's what's so special about the departments right now, even though there's this very like polarized, like older guys and younger guys. I think that it balances itself out a little bit because we've got two obviously different sides of the spectrum and somewhere they're going to interconnect, but and learn from each other. So it will be interesting also to see, I mean, what our stations look like when it is a bunch of younger guys who are needing to take the time because they, are in their feelings.
Yeah, no, it's interesting to watch because like my husband is right in the middle. So there's still the crunchy crusties and there's the babies and he watches both ends of the spectrum and he's pretty neutral. Like, but he's also kind of old school too. So it's fun to watch the crews around each other. And I mean,
Sure.
it also depends on their personalities, obviously, too. But it's going to be interesting in the next like 5 to 7 years, I think, because there's going to be a big retirement like group coming up, and we're kind of seeing it already. But
Yep.
yeah, I'm interested. But it's so funny that you mentioned the whole diagnosing yourself on TikTok and Instagram because it makes me laugh when I mean I'm guilty of it too. Sometimes I'm like, oh, there's another narcissist. Or, oh, there that this one's toxic and this and that, and it's like, are they really a narcissist? Probably
Right.
not.
Right. Or
No.
everybody thinks they have borderline personality disorder.
Yep.
I'm like, you do
Yep.
not have that.
my my husband just peeked in and totally was like, oh gosh, I love it. Oh yeah, it's a wild time out there. Okay, any last thoughts?
No, I can't think of any. I think we kind of covered the topic and the differences and the pros and the cons and the red flags. Hopefully, it's clear. I also I know that you have a vetted list of therapists that you
Yes.
and coaches as well that you trust and that you refer out to. That's amazing. If anyone needs additional, ours lists probably are very similar, but I also have a list. The Overwatch Collective has got one in every state. I was part of their vetting process, so I know that they actually vetted their therapists to be culturally competent and as well as trauma informed. So
I
there
love that.
are a lot of options if you're looking for a therapist, but you don't want to do the work
Yes.
because it's a lot. It can be a
If
lot.
you don't want to look for one, just DM us and we'll
Yes,
help you because it's yeah,
absolutely.
there's a lot. That's the greatest part is that when initially when my husband went to therapy and when we went as a couple, it was like impossible to find a culturally competent therapist.
Yeah,
He was on the wait list forever. Like it was a big deal. And now I don't want to say it's like this, but it's a lot better. Oh, so
good,
much better because now
good.
we know like, well, I thank you thankfully for this. I know a lot of them, but it's a little bit easier to find for sure.
Yes.
Okay. I ask everybody on the podcast this question. Don't think too hard about it.
Okay.
What legacy do you hope to leave for yourself, your family, and your life?
Okay, how do you say don't think about it, but you ask the most deepest convers like, what?
Everybody says that
Let
they're
me
like, don't date too much. What? Like,
what kind of question is
no.
that? Okay, I think off the top of my head,
Hmm.
I think I'd like to be known as someone that is kind, someone that is helpful, especially as a clinician, someone that, puts other people first when needed, but also someone that has taken care of myself and walked the walk, and I think that's something I show a lot on my Instagram is I'm human, I go through hard things. I use the same coping skills that I show my clients how to use. So I think if I could package all that up, being a kind person who is real and uses the same skill set, because I'm also a human.
I love that.
Thank
And are you taking new patients right now?
I am, as long as you're in California. And if you're not in California, I can always situate you with someone who works in your state.
Excellent. And
Mhm.
on Instagram, you are at On Being Resilient. And you
Yes.
also have a website. Is it
Yes.
destinymorris.com?
DestinyMorrisTherapy.com. And then
Therapy.com.
I also have my course that is specifically for the partners of first responders and those who are on fire. I used to do groups for first responder partners. And so I took everything from the group and I made it into a course that you can watch and listen to on your own. There's every topic you can think of. It's everything I hear from the first responder in therapy and the spouse and couples. I lumped it into a course. So that's on there. I will be coming out with a new course soon, and it
Yay.
is for female first responders. So if you are a first responder who's a female, it might be something that interests you.
Oh, that is exciting.
Yeah. Thank you.
Okay, I love that. Okay. Thank you for hanging out with me. I always love chatting with you. You are just such a bright light and so full of knowledge. I just want to like bottle it up because oh gosh, you're
Thank
so
you.
great. All right. Have a great one, everybody.
Thank you.